All right, well, let's get going. First of all, good morning, everybody. I hope the snow didn't shock you too much. It did me, I'll have to say, but my dogs were very happy. My name's Nancy Frank Wilson with the Minnesota Oral Health Coalition. I am just so excited and honored to host or co-host this webinar or Infomar this morning with our very special guest. Today's presentation is the reason that we do these. We have a member who's doing some amazing research and some graduate education, and she's willing to share it with all of us. So welcome to Minnesota Dental Providers' Knowledge of and Interventions for Electronic Nicotine Delivery Systems, or ENDS, in youth. I'm just going to do a brief introduction of Deb, and then you can take it away. So our presenter, Deb Merrigan, is currently a dental hygiene instructor at Normandale Community College and a dental hygienist at a private practice in the Twin Cities area. Previously with Century College in White Bear Lake, she has over 6 years experience teaching didactic, clinical, and laboratory courses in their dental hygiene program. Areas of expertise include community dental health, patients with special needs, dental hygiene theory and practice, radiology, pharmacology, and pain management. Deb is nearing the completion of her master's degree in dental hygiene education at the University of Missouri, Kansas City. As a part of her graduate degree, she is asked to disseminate her research findings on Minnesota dental providers' knowledge of and interventions for electronic nicotine delivery systems in youth to help professionals and other stakeholders who hold an interest in oral health, which we all do. So again, thank you, Deb, and I will, I'll let you take it from there. I'm sorry, one bit of housekeeping. If you have questions, just put them in the chat and I'll be checking them, and I'll facilitate those to our presenter. Thanks.
Thank you, Nancy, and I wanted to welcome everyone and thank you for joining me in this presentation regarding dental health and electronic nicotine delivery systems. So as we move through this presentation, my goal is to be able to describe to you what are electronic nicotine delivery systems. I'll be discussing the recent landscape of ENDS use among youth. We'll look at Minnesota dental providers' level of knowledge of ENDS, what I found from the results of my study, and also identify whether Minnesota dental providers are conducting screenings, education, and cessation counseling practices with their patients. We'll discuss barriers of providers reporting with traditional and ENDS product education, and maybe how it differs between adults and youth patients. And also I will be sharing with you some professional and patient resources for ENDS interventions. So what are ENDS? Electronic nicotine delivery systems, or ENDS, are designed to deliver nicotine, flavorings, and other additives to the user via an inhaled aerosol. They're also known as e-cigarettes, e-cigs, e-hookahs. They've been called vape pens or vapes. They can be known also as mods or tank systems. And they appear like traditional cigarettes or writing pens. They could even look like USB flash drives or even asthma inhalers. I do want to mention that throughout this presentation, you'll hear me using the term ENDS, but I also might interchange it with other terms like e-cigarettes and vaping. So in a 2000,
I'm calling to confirm that. I said I'm not sure what happened, and this is.
Oh, sorry.
Sorry,
Okay.
I'll make sure everyone's muted.
Oh, sure. Yeah. So in 2021, the National Youth Tobacco Survey came out with data, and what they found was more than 2 million youth currently use ENDS. And within the last 30 days, about 11.3% of high school students and about 2.8% of middle school students were using ENDS at least once in the last 30 days. And among those current users, about 1 in 4 were using them daily. and nearly 85% of those were using flavored ends. And you'll hear me talk more about those flavored ends and how the FDA is trying to ban flavors just to decrease the attractiveness of using ends products. What I was able to find as of October 6th is new information. The National Youth Tobacco Survey came out with their 22 data. And if we compare the 2021 and the 2022 data on the use of ends, at least once in the last 30 days, we do see an increase of 2.8% for high school students from the year 2021 to 22, and then about a 0.5% increase for middle school students. Also within the new 2022 data, it reports that a quarter, about 27.6% of current youth e-cigarette users are using e-cigs daily. And when we look back at that 2021 National Youth Tobacco Survey, the most common reason youth first use ends was that a friend used them. And the most common reasons that they are using them would be feeling of anxiousness, being stressed or depressed, or even looking to get a high or a buzz from the nicotine. I thought it would be important to bring up Healthy People. You may or may not be familiar with Healthy People. It has been around since the 1980s. It's a federal agency of the Office of Disease Prevention and Health Promotion. It provides 10-year measurable public health objectives addressing the latest public health priorities and challenges. And they use this data to set national targets and to track progress toward achieving objectives that they have established. And it does include general and also oral health. And the goal is to help organizations, communities, and states across the nation focus their resources and efforts on improving the health and well-being of all people. So data from this National Youth Tobacco Survey that we just viewed is used as a baseline for comparing progress toward meeting selected Healthy People goals for reducing tobacco among the youth. So I wanted to share with you 3 of the Healthy People 2030 objectives related to youth and tobacco use. And when we look at this first objective that I'm sharing, it looks at reducing current cigarette smoking in adolescents. So we're talking about traditional cigarette smoking. And what we're finding is that the target has been met for these objectives. Most adults who smoke cigarettes, they start before the age of 18. So preventing traditional cigarette smoking in these adolescents is key to reducing smoking as they go into adulthood. And cigarette smoking is a cause for cancer and the leading cause of preventable death here in the US. So we are meeting this target. If we look at the next Healthy People objective that I wanted to share, it is focused on reducing current e-cigarette use in adolescents. And adolescents are more likely to use e-cigarettes than any other tobacco product, and the rates of e-cigarette use has risen sharply in recent years. So this current objective has actually seen little or no detectable change. And while the target is set at 10.5%, the most recent 2020 data is showing it higher at 13.1%. So we have some work to do on reducing e-cigarette use in adolescents. And the third objective from Healthy People 2030 that I wanted to share with you is related to reducing current use of flavored tobacco products in adolescents who use tobacco. So again, we're focusing now on that flavored tobacco product. And as I mentioned previously in a slide, that nearly 85% of youth are using flavored tobacco or flavored ends products. Now, this is a newer objective that wasn't in previous objectives for Healthy People 2020, 2010, and even more historically. So this one is set as a baseline only, and the goal will be to lower the percentage from 77.5% down to 73.2. So it'll be interesting to see as we move forward with future data collection that we hopefully see a desired decrease in flavored tobacco product use among our youth. So I wanted to talk a little bit about my research that I did over the summer. So in the summer, I conducted research on Minnesota dental providers' knowledge and interventions for ENDS in youth. I did a cross-sectional study. It was conducted electronically through a statewide survey of Minnesota dentists, dental therapists, and dental hygienists. The aims of the study were to assess Minnesota dental providers' level of knowledge of ENDS and determine whether Minnesota dental providers conduct ENDS screening, education, and cessation counseling with their patients, and then to identify what barriers providers were reporting in providing traditional nicotine and ENDS product education. And also, did the barriers differ between adults and youth patients? So I developed survey questions that were sent out to the respondents. And I wanted to pull 3 questions from the survey that I would like to test your knowledge with. So feel free, you're welcome to type your answer in the chat box if you feel that you'd like to share. Otherwise, you're welcome to just keep the answer to yourself until I have the big reveal. All right, so I'll give you just a moment. And then we'll start with question number 1. So question 1, one of the questions on the survey was, what is the legal age to buy electronic nicotine delivery system products in the US? So again, feel free to throw your answer in the chat box, or you're welcome to just keep that to yourself. So is it 18, 19, 20, or 21 years of age, the legal age to buy ENDS products in the US? Well, if you answered 21, you would be correct. So when I looked at the results and analyzed my survey answers, only 27% of the respondents from this survey selected 21 as the correct age. Most incorrectly identified the legal age as 18. And I'm thinking perhaps those that were surveyed maybe not, they weren't aware of the more recent changes in the legal age from age 18 to 21 nationally. So in 2019, the federal minimum age for the sale of tobacco products, which includes ENDS, was raised from age 18 to 21 across the US. And the Food and Drug Administration classifies ENDS products as tobacco products. It is illegal for a retailer to sell any tobacco product, including ENDS, to anyone under the age of 21. And I should go back to say, why does the FDA classify ENDS as a tobacco product? Well, they look at the nicotine as that addiction piece. And while ENDS products don't have the tobacco in it, it does have the nicotine. And therefore, they are associating the nicotine and including it as a tobacco product. So while the legal age is 21, manufacturers are continuing to target youth through the marketing of ENDS. So they are looking at social media news feeds as an outlet, sponsoring music festivals and events, and even packaging e-liquids with kid-friendly flavors to look like common food items, as you can see in the image on the lower left. Juul, which is a popular brand of ENDS, paid for company-sponsored ads on Twitter, Instagram, and YouTube to promote images and advertisements that associate Juul with being fun and cool and relaxing, having a sense of freedom, and then even sex appeal. So the most popular of ENDS products out there among youth currently is the puff bar. And if you're not familiar, which I wasn't until recently, the puff bar is a disposable synthetic nicotine product. It is not authorized by the FDA, and therefore it should not be on the market. It is illegal for retailers or distributors to sell or distribute ENDS that aren't FDA authorized. And keep in mind too that the FDA has no intention of authorizing any flavored products other than tobacco, which I'll talk about in just a moment. But they get around being able to do this by just still putting it in the stores and online, and having friends, and older people are not being carded, and youth are getting access to these ENDS products. So up until October 2021, FDA had not authorized any products that were ENDS for sale. And now they have come up with one product called the Vuse Solo, which is an ENDS product or an e-cigarette with only the tobacco flavored replacement cartridges that is authorized. So no flavored, no menthol, only the tobacco flavored. And this manufacturer of Vuse is the R.J. Reynolds Vapor Company, which is a division of the Reynolds American Incorporated rather. This Vuse uses a nicotine salt-based e-liquid and is available only in a 48 milligram per milliliter nicotine strength is what is authorized by the FDA to be sold. And keep in mind, nicotine strengths, they can range from 3 and up to 60 milligrams. Now, nicotine salts are kind of a more preferred form for a lot of youth and adult users, as they are less harsh on the throat and providing what is quoted as a smooth inhale for the user. To be authorized by the FDA, a manufacturer must demonstrate that the marketing of the product is appropriate for the protection of public health. So when FDA is comparing to users of non-tobacco flavored ENDS products, they're thinking that young people are less likely to start using tobacco flavored ENDS products than a flavored product, and therefore not switching to maybe a higher, more risky product such as our traditional or combustible cigarettes. So the FDA's view tobacco products or flavorings rather are less appealing to youth. So they're less likely to purchase or use these types of products, and there's still not a lot of data out there, but it may be beneficial for adult traditional cigarette users who completely switch to ENDS, that it might significantly reduce their cigarette consumption and quote unquote better health alternative. Again, the studies are not out there yet definitively saying that using ENDS as a cessation tool is acceptable yet. So let's move on to question number 2. My question to you, and again, chat box or keep it to yourself until the reveal. Electronic nicotine delivery systems, are they FDA approved as a smoking cessation tool in which of the following populations? So I kind of maybe have slipped and gave it away already, but if you were to say they are FDA approved as a smoking cessation tool, which of the following populations would you say that it is true? If you were to say none of the above, you would be correct. And when I looked at the responses to the survey, while more than half of the respondents did select none of the above as the correct answer, nearly a third thought that the FDA had approved ENDS as a cessation tool for adults age 21 years and older. And I think this may be because some healthcare communities and tobacco cessation resources suggest e-cigarettes and other ends can be a smoking cessation method for adults as a safer alternative than traditional cigarettes. So the FDA stance, I might have briefly touched on this already. ENDS products are not approved right now by the FDA as a cessation tool. They're saying that there's not enough scientific evidence to support ENDS as an effective tool for quitting smoking. And keep in mind, switching from traditional cigarettes to ENDS is really not quitting. It does still expose the user to nicotine and other toxic compounds. And finally, my third question to you all, approximately what percentage of youth ages 10 to 19 who use ENDS products will go on to try traditional cigarettes within 1 year? Do you think none of them, or 25%, 50, or 75%? Well, if you said 25%, that would be the correct answer. And when, again, my survey responses, when I analyzed the data, over a third of the respondents correctly identified that 1 out of 4 youth will go on to try traditional cigarettes within 1 year. Nearly 1/2, though, thought that the percent might have been even higher at 50% of youth would go on to try traditional cigarettes. In 2018, the US Surgeon General put out a call to action to curb the epidemic of youth e-cigarette use in America. Several studies show that ENDS use is strongly associated with the use of traditional tobacco products among youth and young adults. So we're seeing this as a potential gateway from segueing from nicotine ENDS products onto combustible or traditional cigarettes. We're also seeing an increased potential risk for future addiction to other drugs like marijuana with the use of ENDS. So does vaping lead to cigarette smoking? Does vaping and ENDS products, do they lead to cigarette smoking? I wanted to share with you from Johns Hopkins University, a 1-minute video on the insights of potential dangers of vaping and why avoiding cigarettes and their electronic alternatives is the healthier choice.
We know that electronic cigarettes can help certain adults quit smoking, but there's an enormous potential harm with electronic cigarettes, and that's young people using them, usually as their first tobacco product. It is amazing that these kids who are using these products have such a poor understanding of what's actually in the products and their health effects. For example, many kids don't know there's nicotine in these products. Many kids think that because there's no combustion of tobacco that they're perfectly safe, or that we have evidence that they're safe. And a lot of kids, of course, find it more socially acceptable to use them and somehow equate that with them being perfectly safe. They don't understand that these can be just as addictive in certain circumstances as smoking cigarettes. People who start using electronic cigarettes are more likely to go on to use other illicit drugs or to go on to smoke later in life. So in other words, we might be causing the next smoking epidemic via young people getting addicted to electronic cigarettes early in life.
So while we are seeing a decrease in youth using traditional tobacco products, cigarettes, we might find later down the road, as the potential to transition from ENDS to traditional cigarette use, that might actually increase. So I wanted to move on to talk more about my research study and share with you some of the data on the knowledge and the screening and cessation counseling, and also barriers that I had identified that were significant findings. My first objective with my research study was to evaluate the Minnesota dental providers' level of knowledge of ENDS, and were there differences between personal or practice characteristics. So when we looked at the level of knowledge and age, Younger respondents, those that were aged 30 years old or younger, were significantly more likely to have higher knowledge than those that were over the age of 30. And maybe because they were younger, more fresh out of school potentially, having had more evidence-based research shared among the dental institutions in the curriculums, perhaps that is why they had higher knowledge. You might have some thoughts of your own of why this the data shows what it does here. And when I looked at the level of knowledge and nicotine product use, respondents who use nicotine products some or every day were significantly more likely to have higher knowledge scores than those who didn't use nicotine products. And perhaps being around others that use ENDS products or even traditional cigarette products and tobacco products, they're more familiar than those that don't. And when I looked at the level of knowledge and years in practice, those that have been practicing fewer years, 0 to 5 years, were significantly more likely to have higher knowledge scores than those that have been practicing 6 or more years. And again, is it related to the younger populations maybe coming out of schools, that they had fewer years of practice, that they had that educational piece out of dental school? Or is it that they are among other users, younger users, if we're thinking of age and years in practice, that have friends or family that also use ENDS and are more familiar, and then social media and so forth. When I looked at in determining my second research objective, it's related to screenings and education and cessation counseling with dental providers and their patients, wanting to see if there were any differences between adults and their youth patients on the screening, education, and cessation. So when I looked at the screening, education, and cessation counseling for traditional nicotine products, the respondents were significantly more likely to see, respondents were for traditional nicotine products were significantly likely to for adults, for all three than for youth. And then we're looking at the screening, education, and cessation counseling for ENDS. Rather than all three, I only saw more significance with the screening for adults than youth. It was interesting that I didn't find any differences in education or cessation counseling when it related to ENDS products between adults and youth. When I looked at my third research objective, identifying barriers with Minnesota dental providers reporting and providing traditional nicotine and ENDS product education, I wanted to see what barriers differed between adults and youth. And what I found, based on the following 9 barriers, and I'll go through them each quickly. We looked at on the survey asking about low or no reimbursement rates, a lack of knowledge, lack of formal training, lack of time, lack of patient education materials, patient resistance and negative feedback, providers resistance, providers that don't think it's an effective thing to offer, and then providers that aren't interested in providing at all. So these were 9 of the barriers, and on the survey, respondents were also able to write in if they had other barriers that weren't identified on the survey itself. But when we looked at those barriers, traditional nicotine and ENDS, what I found for traditional nicotine products, that respondents were more likely to report patient resistance and negative feedback as a barrier for adults than youth. But when I looked at barriers for ends, when we look and compare adults with youth, no differences were found in any of those 9 barriers that I listed to providing education for ends products between the adult and the youth patients. Moving on, I wanted to touch base with the health effects of ends. And under general health, nicotine exposure can impact learning and memory and attention on a youth's developing brain. And that's been a huge focus in a lot of the studies that I did literature reviews on. The brain keeps developing until about the age of 25. And when nicotine is introduced, as it would be with most ENDS products, it changes how the connections between the brain cells are formed and harming part of the brain that controls attention, learning, memory, mood, and impulse control. And know that nicotine is an addictive drug, and it is found in both tobacco products and ENDS products. And these products, they can rapidly deliver that nicotine to the brain. And inside that brain, that nicotine then triggers the release of a chemical called dopamine and then some other types of chemicals, which helps a person feel good. And this pleasure response to that dopamine, for example, is a big part of that nicotine addiction. And as nicotine repeatedly stimulates those parts of the brain, the nicotine, or the brain rather, gets used to having nicotine in its system. So when a person stops smoking, they can get irritable, anxious, and upset, and they might even have difficulty concentrating or sleeping, having strong urges to smoke, or feel generally uncomfortable. And all of those that I described is part of the withdrawal. Studies show that using nicotine in adolescents can also increase the risk for future addictions to other drugs. So something to keep in mind, not only using nicotine in ENDS products, but what it can lead to once the youth are addicted to nicotine, that they can go on to marijuana and other cocaine and other potentially adverse drugs. There are emerging data on chronic lung disease with general health as it relates to ENDS, asthma, and even cardiovascular disease. When we look at the oral health side effects of ENDS, there is an increased risk of gum disease, perio disease, including bone loss and tooth loss. There's increased risk of tooth decay, dry mouth, and even a sore throat. There are lots of campaigns out there to educate youth about ENDS. And there are population level interventions. Others, in addition to the campaigning, there's price increases that they're trying to get for these products. There's mass media campaigns, and then there's smoke-free policies that are in place to help curb the use of ENDS, especially among youth. I wanted to share with you a couple of those national campaigns to educate youth and promote cessation. One of them is by the FDA, the Food and Drug Administration. It's a public education campaign focusing on educating youth about the health consequences and the risks of vaping and smoking. So it's been a huge and popular and successful campaign. And what I'd like to do is just share this 30-second rather clip on my vaping mistake.
My anxiety got really bad after I started vaping, and I was never an anxious person before. I started having panic attacks. I couldn't really breathe, like my heart was beating so fast. At first, I didn't think it was like addictive. I thought I was kind of stronger than it, but soon I realized like it was holding kind of a power over me. I was always craving more and more, like it was never enough. When I quit vaping, I had a lot more energy. I'm someone that has done it, and it's not worth the consequences that are gonna come. My anxiety.
And there's another campaign that I wanted to share with you. It's put out by the Surgeon General's office, and it's called Know the Risks of E-Cigarettes and Young People, and it focuses on nicotine.
Some say e-cigarettes aren't dangerous,
But science shows nicotine can harm teens' developing brains.
no matter how they're exposed.
Let's do an experiment to find out.
Here's a teen who won't be using e-cigarettes.
Now we need one willing to risk their brain development.
Anyone care to volunteer your kid?
Anyone?
I'm Dr. Vivek Murthy, U.S. Surgeon General. Your kids are not an experiment. Protect them from e-cigarettes.
Again, another campaign that has been very successful in getting the word out, especially among youth and their peers about the risks of e-cigarettes and tobacco, or nicotine. I want to segue to healthcare providers and other stakeholders, how we can play a role in reducing the use of ENDS with our youth especially. I had mentioned earlier about a call to action by the Office of the Surgeon General. So health professionals, policymakers, and other stakeholders can play an active role in curbing youth ENDS use. So with this call to action, they're looking for strategic, comprehensive research to be done to identify potential health risks from ENDS use, because there's not a lot of research available right now about the health and the oral health risks of ENDS use. There is some, but there still needs a lot more research out there to support reducing the use of ENDS with youth and why the risks outweigh the benefits. The call to action also is hoping to develop and promote programs and policies at the state and local levels to prevent ENDS use among youth and young adults. And then also educate health professionals, parents, teachers, coaches, and other influencers of youth about the risks of e-cigarette use among youth and young adults. So there are previous studies on healthcare providers' knowledge of ENDS. I have found more related to traditional tobacco cessation, which has been around and numerous studies over decades has resulted in a lot of information about good cessation methods such as the 5 A's, to ask, assist, advise, and so forth, and other types of cessation motivational interviewing and so forth to help healthcare providers in general reduce traditional tobacco smoke with their adult patients. And what we're finding is there isn't enough research on best methods for ENDS products. And what they're finding too is with the limited data available and with a push for using ENDS as a healthier alternative to traditional tobacco, it's harder to get the word out there. So again, more research is needed among healthcare providers and even oral healthcare providers on how to have our professionals more knowledgeable, getting the word out there, providing trainings to educate our providers and to have the materials and resources available for them to share with their patients and having that comfort level. So are you prepared to discuss ENDS with adults and youth? Again, part of our oral healthcare provider role is smoking and tobacco and ENDS cessation counseling. It's part of our scope of practice. And so when we look at our roles, it's very important to be knowledgeable about ENDS. And part of that includes having even the right lingo or being familiar with the lingo, especially among our youth. And I wanted to share with you 3 terms that I was not familiar with. The first one is vapor's tongue. So if you want to be impressing young adults, you could talk about vapor's tongue and asking them, you know, have your taste buds become desensitized with the use of ENDS? Then there's throat kick and throat hit. which is a tingling feeling in the back of the throat when that vaporized e-liquid that contains nicotine hits the back of the throat. And then there's another lingo called nic-sick, which refers to a non-specific symptom of exposure to nicotine. So youth are using these terms to describe how they're feeling. And if you went on to the truthinitiative.org site, you can find a whole lingo dictionary on ENDS terminology that youth and adults use to describe ENDS. And so we also want to, as oral health care providers and other stakeholders, be familiar with the types of ENDS products that are out there and the looks of those end products. Remember, some of them can look like asthma inhalers or USB drives or pens. Be familiar with the brands. Juul has been in the media and very familiar, and teens have reported, oh, I am juuling. So it is a very popular term and a brand used. There's those puff bars that I talked about earlier, which is the most common among youth right now. There's another popular brand called Smoke and another one called Blue, and the list goes on, but just being familiar with some of the brands. Knowing the general and oral health risks that are currently out there with evidence that we can share with both of our adults and our youth patients. Talk about nicotine addiction and talk about nicotine and youth brain development, especially, among our youth. And then also consider dangers of using other substances like marijuana being used in those ENDS products. So with quitting ENDS, that physical, mental, and emotional part of quitting is mostly caused by that nicotine addiction. So while more research is needed about the best way to quit ENDS, what we're finding is resources and programs that are designed for traditional tobacco product cessation can also be helpful with ENDS cessation. Now, we do still need to, in the future, create more user-friendly ENDS cessation pamphlets and materials and training and so forth. But right now, oftentimes we're seeing that the traditional tobacco cessation does a pretty good job with helping with ENDS cessation as well. The ADHA, the American Dental Hygienist Association, partnered back in 2018 with the CDC. And the CDC had a campaign called Tips from Former Smokers. And I wanted to mention a quote from Ann Bettrell, who is the ADHA CEO. And she says, dental hygienists see the direct impact of smoking and can play a key role in educating patients and caregivers about tobacco use. And keep in mind, this does include ENDS products. Incoming calls from the Minnesota State Quit Line, they saw an increase by an average of 94% during that 2020 TIPS campaign that they ran. So 94% with increased calls to our local state Quit Line. Our Quit Line service here in Minnesota provides free cessation counseling and also medications. So take a few moments here. I believe Nancy will be sharing with you links in the chat box. Great, thank you, Nancy. On professional resources for you to use. And then I'll also have patient resources available that she'll share that you can feel free to explore and use with your patients and others. One of them is, go ahead.
If it's okay, I think what I'll do is I'll email all these out to everybody, so then they'll have them in one place, if that's okay.
Yeah, I think that's wonderful.
Great.
Thank you. Good. So with those professional resources, the ADHA, again, the American Dental Hygienist Association, has done a fantastic job with providing resources for us as healthcare providers and for our patients. There are webinars on tobacco cessation available to you, using motivational interviewing techniques to help your patients quit tobacco and ends, and then also educating them on some pharmacological alternatives. There's also cessation training and guides for providers, and then also providing current trends with ends use and youth. And the most updated information regarding like Healthy People 2030, you can keep track of what those objectives are and how we're doing, if we're meeting our targets, or if we're not working toward what we need to. Professional resources, again, through the ADHA. There's another video within the link that is about an hour long. It's called Help Patients Quit Tobacco. It looks at understanding the latest trends in ends among youth and teens. It discusses how to perform a tobacco cessation clinical intervention, and it also has tobacco cessation resources. Other professional resources, the Food and Drug Administration has a resource titled Resources for Professionals About Vaping and E-Cigarettes. Fantastic website that I encourage you to take a look at. The Surgeon General also has great information for us. It's healthcare professionals, educate your patients about the risks of e-cigarettes. Some really great resources out there. And we just need to get the word out to dental practices and other stakeholders of where this information is. It is out there. It's just getting it in contact with our professionals, so we feel more comfortable and being knowledgeable to be able to talk to our patients, our adults and our youth about ends use. We do a pretty good job with our traditional nicotine products, but we need to work on the ends products. Patient resources that are available. There are mobile apps, websites, telephone quit lines, text messaging programs, and even a live counselor that can walk people through quitting smoking. So a lot of different patient resources out there as well. So to kind of recap, we know that we're stronger with traditional nicotine product cessation than we are with ends product cessation. There is still not enough research out there to support risks versus benefits of ends, especially as a cessation tool. And the FDA, again, has not authorized and approved, rather, ends use as a cessation tool. There is a lack of knowledge in the provision of screening and education and cessation counseling and barriers regarding ends among dental providers, and that's concerning. Education and formal training should be carried out with both allied and dental curriculums and in dental practices as well, as it's a professional responsibility for us as dental providers to promote healthy behaviors. And in order to bridge the gap of information related to ends, emphasis must be placed on developing prevention strategies for end cessation, and to provide that education, the training, and those resources for dental providers and others that address ends. I do want to acknowledge the support that I've had throughout my research. I want to thank tremendously my committee at the University of Missouri, Kansas City School of Dentistry, my chair, Julie Sutton, and then Lori Holt and Joanna Scott, Tanya Mitchell, and then Kat Bowles. I also want to thank Barbara Adkins in the research office at UMKC, who helped with the IRB submission. And then I also want to give a huge shout out to Bridget Anderson at the Minnesota Board of Dentistry, who was invaluable with being able to distribute my survey out to the Minnesota providers. And so I had the opportunity to be able to collect that information and share it with you. And so thank you to all of them. I do want to put out questions Any questions or comments that anyone has out in the audience? I'd love to hear from you.
Deb, while people, while our participants might want to type something in the chat, I just want to say thank you. I learned so much. This is incredibly interesting. Just a couple thoughts that I had again, and please, if you have any comments or questions, put them in the chat. We've already got one saying, it was a great presentation. I just want to say that I want to thank those professionals in Minnesota who took this survey. I know people are busy and, we get a lot of things that come at us. So for the people the professionals in Minnesota who took the survey, thank you, because it's important, right? That we have this. Couple other things. So all the resources I can email them out to you. That's why I have you do the Eventbrite. So I have your email address. I'll post this video to our YouTube channel, and I'll also send you the link for the presentation on our YouTube channel. And please share that with people that couldn't make it today, or maybe someone didn't know about this and you can say, hey, I saw this, it's great, and here's a link. I think there's so much here for us to take in our work. And one of the things that I love about the coalition is that we're really diverse. We have professional providers, both medical and dental. We also have educators and public health, and we have such a great variety of people. And the work that you've presented and the resources that you've shared, we can all use them.
Mm-hmm.
Yeah, so I'll check and just see if there's any questions. Right now, it's just people really appreciative of your presentation. And
thank you. And this has sparked such an interest for me on a personal and professional level, having teenagers that are now in college but have experimented with this. I had no knowledge when I found what I thought was a USB drive in my kid's bedroom. It was sticky. I'm like, why is it sticky? What is this? And sure enough, it was part of a cartridge for an ENDS product, and I had no idea. And so from there, it branched out, and I thought, how, what's going on out in the community, and this is going to be a launching pad for me. I know it is, to explore more further research. Obviously, there's so much more to be done yet, and I'm looking forward to doing more surveys and asking more questions and trying to find, evidence and go from there.
well, and I have to tell you, what you just described has been my experience with some younger people. And what I thought was really interesting is, and you mentioned this earlier in your presentation, is I know young people in their early 20s who vaped, who would never have picked up a cigarette. I mean, the idea of smoking a cigarette is just abhorrent to them, but vaping was different. And of course, I got in there with my education and my public health hat and my health hat on, and people were like, oh, didn't even think of that. I'm like, yeah, this is tobacco.
Right. And really, I think I brushed over, and if I had to do over, I would emphasize even more that youth come into using ENDS products having never smoked a traditional cigarette. They're not using it as a tobacco cessation tool. They're coming in having never smoked a cigarette, just experimenting with ENDS as their first tobacco product. And again, with those flavors that are available, it's fun. It's more discreet with an aerosol versus the cigarette smoke and so forth. So yeah, it's a big problem.
Well, and it's incredible when you showed those pictures. I mean, it's candy.
Yeah.
It looked, I mean, I looked at those and I've seen some of them before, but you had some that I thought, God, you'd think it would just be in the candy aisle when you go to the store.
I have read there's over 7,000 flavors. 7,000.
Oh my gosh.
How many PowerPoint slides would that be to cover all of those? Yeah. So right
And-
now, again, just to reiterate, FDA tobacco only flavored right now, and menthol is on the fence, but they want to do away
Okay.
with menthol as well. Mhm.
Well, if you didn't know this before, the MOHC will partner with you on anything that is appropriate. I think this is such a big topic for us going forward. I know it's almost 10 and many people will have to leave. On behalf of the coalition and all of the people that are here today and the many, many more that will see this on our YouTube channel, thank you so much.
Thank you for having me. I appreciate
Yeah.
everybody attending. Thank you so much.
Yeah. Okay. Bye, everybody. Thank you for attending and have a great rest of the Friday.